Here I'm using the nerve stimulator to find the marginal mandibular nerve in preparation for a skin tightening procedure called the ThermiTight procedure. As you can see, the nerve stimulator emits electricity and the nerve twitches and I can find the nerve. I mark the areas out. Here I'm marking the thyroid gland out to protect the thyroid gland, as you can see. Then after we mark the patient out, in preparation for the ThermiTight procedure for skin tightening, I start delivering tumescent anesthesia through this probe. This is a fluid that only numbs the area, but it also stops bleeding, so the procedure becomes virtually bloodless. Then we use the ThermiTight probe. This is a probe that's attached to a radio frequency machine, and we systematically and precisely heat the skin from inside out. This concept of heat causes contraction, a very dramatic contraction, because we're taking the temperatures to very high level, to very safe high levels, while we're monitoring the patient with a camera that's an infrared that's attached to the screen. And as the skin heats up, the areas become orange like this. So we can very systematically and safely raise the temperatures to the highest level for maximal skin contraction anywhere in the skin.